Hi, my name's John Hanley. I'm a consultant up at the Newcastle Haemophilia Centre, and I'm very pleased to be speaking to you this afternoon about physiotherapy best practice and what patients should expect from their haemophilia centre. I'm really sorry I can't be there in person. I've got a family commitment on Saturday which I couldn't get out of, so I hope you're having a great meeting. So, what can I tell you about physiotherapy? Well, I'm sure we'd all agree that to deliver really good, high quality care for people with bleeding disorders, you need a multi-professional team. And this is a picture of some of the members of our team up in Newcastle. So we have the nursing staff, the medical staff, the clinical psychologist, the social worker, all bringing their particular skills to providing care for the patients. And the physio, our wonderful physio David, is highlighted by the arrow. He brings his particular skills to the team, and working together we try to provide high quality care. So why is physiotherapy so important? Well, we all know that bleeding into joints and muscles can be a particular problem for patients with haemophilia. So the whole emphasis these days is on prevention and the use of prophylaxis, which has become more aggressive, newer treatments like emicizumab, all focusing on trying to prevent bleeding through the medical management. But inevitably, sometimes joint and muscle bleeds do occur, and this is where the particular skills of the physiotherapists are so important in terms of not only limiting any damage as best you can, but also taking the important decisions about when to immobilize the joint, when to start the rehabilitation. This is a very important aspect of physiotherapy care and is really only delivered by physiotherapists who have particular experience and training in the field of haemophilia. And apart from dealing with acute joint bleeds, the physiotherapist is very important in maintaining musculoskeletal health. So there are many problems which can be identified through regular physiotherapy sessions, and then strategies developed with the patient to try and avoid problems developing over time. And part of that is the importance of surveillance of the joints through regular assessments and joint scores. And now many physiotherapists do near-patient ultrasound assessment of joints to provide even more detailed information about what's going on in a joint. So all these aspects of physiotherapy contribute to the holistic care of the patient, with the aim of maintaining as healthy a situation as possible through minimization of bleeds and active surveillance to pick up problems at a very early stage. So what should patients expect when they go to their haemophilia centre? Well, firstly, all patients should have access to a physiotherapist who they know and they get to know over time. They should be a very visible member of the team, and physiotherapy review both for acute problems and in clinics should be very much the routine. And apart from what I've mentioned already in relation to keeping joints healthy, the physiotherapist has particular expertise in terms of giving advice about lifestyle and sports, safe sports to maintain muscle strength and healthy joints is important. Sometimes there might be situations where assessment at home is needed, and that should be potentially available from the physiotherapist at the Haemophilia Centre. In children, input into schools and advice to employers can also be very, very important to make sure that that barriers aren't put in the way of either schooling or in the employment situation. And then our physiotherapist is very involved in decisions about surgery, orthopaedic interventions, and rehabilitation after surgery. So these are all different aspects of physiotherapy care which should be available to patients with bleeding disorders at their Haemophilia Centre. So what do we know about the reality? So if that's what should be happening, what is happening? And we now have quite a lot of information in the UK about the quality of service and access to physiotherapy and other aspects of comprehensive care. And the main source of this information has been the peer review process. So the UK CDO joined forces with the Quality Review Service, which is based in the West Midlands, which sadly has recently been disbanded, but that's another story. But we undertook a detailed peer review of all the haemophilia centres, all the comprehensive care centres and several of the larger haemophilia centres, looking at how their service measured up against quality standards, and there were many of these. So overall, the quality of care was good, but there were often gaps, and the main issue which was highlighted in many haemophilia centres was staffing issue. You can see the individual centre reports, and there's also this overview report which was produced at the end of the process. In all, 37 centres were inspected, and the whole process took just over a year to complete. Fortunately, it was all done and dusted before COVID hit. And when you look at some of the issues that were highlighted, let's have a look at it. So when each individual haemophilia centre was looked at, so 37 in total, you can see that staffing was judged inadequate in different staffing groups in a significant number of haemophilia centres. Now, that doesn't mean that the quality of care wasn't good, because the staff that were there were delivering the care in a very committed way. But inevitably, without adequate staffing, it's very difficult to maintain adequate and high quality care over time. So when you look at the physiotherapy bar here in the middle, 15 centres were judged to have adequate amount of physiotherapy provision, and that meant the majority of centres were judged to be inadequate by the peer review standards. So what happened when a peer review visit is undertaken is that the centre then has to develop an action plan to address the areas where they were judged inadequate. So in this slide, we show the progress that has been made between the initial peer review visit and a subsequent assessment undertaken in May of this year. And you can see that compared to the initial visit, the number of centres that were judged to have adequate physiotherapy staffing provision had increased from 15 to 20. So that means that there are still 16 centres where there were problems with physiotherapy staffing. That's not to say that progress isn't being made in some of these centres. It's just that the proposals hadn't come to fruition at the time of this assessment. And the reasons for this vary from place to place. There can be a lack of funding. Recruitment of specialised physiotherapists is an issue in some areas, and many centres have some physiotherapy provision with shared posts with other departments, but the haemophilia component isn't enough to provide a really high quality service. And there are also some places that historically have had very little physiotherapy provision and may not realise that it's such an important part of the service. So the Clinical Reference Group, which is the NHS England body which is responsible to improve the quality of care for patients with bleeding disorders, has physiotherapy members who are actively working on this area, and they're organising buddying between centres, so centres with a good haemophilia physio provision are linking up with centres that are struggling in this area to try and raise standards, and they've also drawn up a detailed description of what a high quality physio service looks like. So these are all the ways that we're trying to improve the service, and the peer review will have another look at this. We'll be going back to the centres where there were issues with physiotherapy and find out how they're getting on in terms of grappling. So from the patient's perspective, I hope I've been able to give you a bit of an insight in what you should realistically expect, and what is your experience. Do you have good access to regular physiotherapy or not? If you do, that's absolutely fantastic. If not, you should be asking your Haemophilia Centre team what is happening and how you can help. Look at the peer review report for your Haemophilia Centre, and then, importantly, give feedback to your trust and ask what they are doing to support the Haemophilia Centre, because often the Haemophilia Centre staff have made a case to the trust, but for one reason or another it hasn't resulted in an improvement. Ultimately, it's the local commissioners who are responsible for ensuring a high quality service. So there's also ways to lobby local commissioners to make sure that the peer review standards are being addressed. And don't underestimate the influence of the patient voice, because patients can often really positively influence this kind of situation. So if your service is struggling with physiotherapy or any other aspect of staffing or the peer review quality standards, get involved, and working with the Haemophilia Centre team, you can help put pressure on the trust and the local commissioners to try and improve the situation over time. So I hope that was helpful, and I'd be really keen to hear from you. My email address is on the first slide. I'm very happy for you to email me any questions or anything you'd like any clarification about. Okay, thanks very much.
Hello, it's a great pleasure to be asked to do this talk today about what does great physiotherapy look like. My name is David Hopper and I'm a clinical specialist haemophilia physiotherapist based in Newcastle upon Tyne Hospitals, and I'm the current chair of the Haemophilia Centre Physiotherapy Association. I'd like to give special thanks to Thuvia Flannery and Anna Wells, two other specialist haemophilia physios who compiled the research needed to put this presentation together today. I will start by giving some background to physio provision for people with bleeding disorders in the UK. Specialist haemophilia physiotherapy is considered a core component of the multidisciplinary team that is essential in providing a high quality model of care for people living with inherited bleeding disorders. This aligns to the National Service Specification, which clearly states that all centres must ensure patients have access to musculoskeletal services. This should include direct access to and regular review by experienced specialist physiotherapists. This represents a responsibility for all centres to provide specialist physiotherapy services for both adults and children diagnosed with bleeding disorders that can meet their needs. Good physio. Well, I was so tempted to put a picture of myself here, but I can't take all the credit. So here are some of the UK's finest physiotherapists working with people who have bleeding disorders. This slide shows some information from a study asking about patients' perspectives into what makes good physiotherapist and highlights many individual qualities, but this is not what this talk is about. And if you've not got a specialised physiotherapist linked to your centre, then it's totally irrelevant. Worryingly, a recent quality review service peer review of all haemophilia centres in the UK revealed that this responsibility of physio provision was not being met in a significant number of centres. If your centre was one of these, not meeting standards as patients, I would ask the question, why? A 2021 analysis by the Haemophilia Centre Physio Association, based off data from the QRS review, showed that only 41% of the 37 centres reviewed were providing adequate physiotherapy. This can be seen highlighted in the pie chart on the right hand side, which means that 59% of haemophilia centres involved in the peer review service did not provide adequate physiotherapy cover. It becomes quite apparent that provision of physiotherapy across the UK varies, meaning patients based in some parts of the country do not have access to the same services as patients have in other parts of the country. Is this fair? In addition to the peer review, an all-party parliamentary group report on bleeding disorders, prompted by the infected blood inquiry, further highlighted a deficit in access to specialist physiotherapy. The results of a Haemophilia Society UK 2020 patient experience survey, which included 95 people, showed that support and access to specialist physiotherapy was well rated. However, 14% stated it was not offered even though it was wanted. This adds to the mounting evidence that access to experienced and appropriately qualified haemophilia physiotherapists was not being delivered despite the demand being evident in this community. From this we can conclude that there is a significant unmet need for this cohort of service users, considering the problems caused as a result of bleeding disorders, including joint bleeds and joint arthropathy, among many others. Now, I'm not saying a physiotherapist is the answer to everything, but they can help with many aspects of haemophilia care and are a very useful resource, as we will discuss in the upcoming slides. They are, however, a very important cog in the wheel of haemophilia care, which should include all the professionals listed here, and apologies to anyone that I seem to have missed out. The Haemophilia Centre Physiotherapy Association sets standards of care that they expect should be sufficient to provide physiotherapy services, to allow them to review all severe and moderate patients at least twice yearly, deal with chronic referrals within 2 weeks, and be available to review acute conditions within 24 hours where practicable. The currently accepted standards of care in the UK are that physiotherapy should be provided by a physiotherapist with specialist experience who is a member of the HCPA and have dedicated hours to provide care to patients through their haemophilia centre. It is therefore reasonable to expect these standards are available to all people with a bleeding disorder, no matter where they reside. The World Federation of Haemophilia guidelines agree that physiotherapy should be provided from diagnosis and throughout their lifetime of people with bleeding disorders, and should always be with a physiotherapist with haemophilia experience. At this point, I'll ask a question. Do you know the name of your physiotherapist at your local haemophilia centre? Do you know if you've got one? And if you have got one, how easy for you is it to access the physiotherapist? Reliance on annual bleeding rate for measuring effectiveness of haemophilia treatment will become increasingly less sensitive and reliable as we approach close to zero bleeds for people on optimized factor replacement or other treatments such as emicizumab. In that situation, specialist haemophilia physiotherapists with dedicated time to the service will be vital in tracking and preventing pain and function loss. This hand-in-glove approach, working with people with bleeding disorders to optimize their treatment, minimize the impact of their condition on their lifestyle, advocate and provide excellent support with regards to sports and activities, is likely to lead to better outcomes according to research. As well as improvements in quality of life, physiotherapy interventions have shown to reduce the cost of care through lower factor use. An overall assessment of the cost effectiveness of physiotherapy in haemophilia care showed that physiotherapy represents less than 1%, yes, 1% of the total cost of care for the haemophilia budget, and should be cost effective even if costs are increased to ensure it is implemented optimally. We have many centres currently across the UK that have excellent physiotherapy cover, but as a group, the HCPA are constantly looking to improve access to physiotherapy in centres who have inadequate provision. This slide is based on data collected from Newcastle upon hospitals by myself. 20 patients surveyed were asked one question about would they rate their physiotherapy treatment that they've received on a 5-point Likert scale, with 18 of the patients rating this as excellent and 2 as very good, which were the positive end of the scale. So we are well aware, as the survey from the Haemophilia Society showed, patients or people with bleeding disorders rate their physiotherapy service as very valuable. Classically, physiotherapy provides a broad range of physical techniques including strength and balance training, sports therapy and hydrotherapy, particularly after a bleeding episode. Other techniques such as manual therapy, electrotherapy, cognitive behavioural therapy, pain management, exercise prescription, among many more, are available from a haemophilia service based in the Haemophilia Centre. However, Specialist Haemophilia Physio is not only about rehabilitation following an acute injury or bleed, it also supports lifestyle change, can enhance physical literacy and so decrease future risk of injury, pain and joint damage. And this can lead to an optimization of individuals' opportunities and greater participation in everyday life, leading to changes in both physical and mental health. Physiotherapy encourages people with conditions like haemophilia and other bleeding disorders to take part in sports and exercise safely. The benefits of this reach beyond a person's bleeding diagnosis, with gains to be made in cardiovascular health, falls prevention, maintaining a healthy weight, and so offsetting many of the metabolic disorders prevalent in the general population. It can help drive research in haemophilia settings and improve patient confidence. And the most important thing to remember, it's a cradle to grave service. So this provision should be available from birth to death. The many qualities provided by a physiotherapist in haemophilia are known to contribute to overall quality of life improvements across all age ranges. So remember, I asked you a little earlier, do you know who your physio is? Do you know their name? Can you contact them with any issues? Do you know how easy it is to access your physio? If you have no physio, ask the question, why? Why should other centres across the UK have access to physiotherapy and you haven't? And my advice would be to lobby your centre director and the rest of the haemophilia team in your haemophilia centre about why your access to physiotherapy is limited, if that is the case. There are many benefits to physiotherapy, and I could do a talk on this all day, but unfortunately I've only got 10 minutes. So I'll finish by saying, if you have access to a physiotherapist, utilise this professional. Use their specialist knowledge to help you with any changes that you may want to go through with regards to physical health. Ask them what sports they think will be safe for you to take part in, and what sports might put you at risk of bleeds. With the changing landscape and new treatments on the horizon, the role of the physio will no doubt change within the next few years, and as previously mentioned, for patients who are on treatments like emicizumab, monitoring joint health and monitoring patients will become ever so more important. But this will also give us more time to invest in patients with milder bleeding disorders. So please, whatever your disorder, find out, have you got access to a physio? How do you access your physio? And if you have any questions, use your physio. Here are my references, and that's the end. If you have any questions, we will cover them later. Thank you.